Hi guys, welcome again to your own YouTube channel Ask Your Gynaecologist. I am Dr. Sonal Parihar. Today's topic is a very sensitive topic, a very commonly seen problem. One of you had requested this long back, as I thought it's a very good topic to actually cover on the YouTube, because not many people are aware that pregnant ladies after delivery, they are very prone to undergo depression, postpartum blues. They can even undergo psychosis if they do not get a proper support system. Okay, so before we start with this topic, let me just tell you that there are three ways to contact me or to get a prescription from me or to consult me. One is DocWise app. Please note the spelling, DocWise app. You have to download it from your mobile's Play Store. If you insert my PIN, then you can connect with me on my mobile, and then you can send your reports, send your queries. You can get an answer in writing. We can exchange voice messages. Sometimes I can even call you, but these days for the last few months, there is some network problem. I'm not able to call, but yes, there is an option of calling. I can call you on your Indian mobile number. Okay, the second way to contact me is whenever I go live on this channel and on the other channel, Dr. Sonal's Answers. You can use your super chat option, which YouTube has provided. Use your debit card or credit card, and you can use that in the super chat so that you can send me the question and then you get the answer there and then. The third way to contact me is coming to the hospital. That is the best way to contact a doctor. You can always call my secretary to take an appointment so that I am there in the hospital before you come. You should make sure that before you travel, that I should be there. I am not out of Jodhpur. I live in Jodhpur, so make sure that I am in the city. So that is the best way, and these are the three ways to contact me. Right? So now coming back to the topic, postpartum depression. Now, why does this happen? We all know that we plan a pregnancy, we are so happy to basically have a child, a bundle of joy. You feel like a complete woman when you have delivered a baby. But why does a woman who is so happy with that baby in the hands, why does she undergo depression? Well, you know that when you get pregnant, there are lots of hormones acting on your body. Prolactin, progesterone, estrogen, your body goes out of shape, your appetite goes weird, you kind of tend to gain a lot of weight, your eating habits are all weird, your sleeping habits are all weird, your clothes don't fit you, your breasts are tender, they're growing because they have to feed the baby. So all these changes, plus you are basically planning a new family member in the family. So you and your partner, your husband, you're planning that the financial condition should be good. You are basically planning the baby either because you are running out of age, you think that okay, now enough of job, enough of career, I'm 30, I'm 32, now I need to plan the baby. Then sometimes the relations between the partners are not very good, or the relations with the in-laws is not very good. So you plan a pregnancy so that your relations become better, the bonding becomes better. And then of course, everybody wants to have their own baby. So there is so much planning going on, and then suddenly when the baby comes out of the womb, you're very happy, you're crying, oh my god, I just got this bundle of joy in my hands. But then suddenly your body, it starts dropping all the hormones which were so high. Your progesterone drops, your estrogen drops, your prolactin goes high, because now the breast will start feeding, right? The milk will start coming out. Your thyroid hormone sometimes stops working for a couple of days. It is a shutdown just after pregnancy. So these all things, plus the physical changes that your body has gone through, you become so loose everywhere, like a jelly belly. Suddenly you've lost 5-6 kgs because the baby is out, the liquor is out, the placenta is out. So yes, you do feel lightweight, you lose 5-6 kgs, but then everything is loose. Your skin is not the same, your body is not the same, your face is not the same, you're losing hair, plus the baby is not letting you sleep. You are anxious that I will not be able to take care of this baby because I'm so new. You have become mother for the first time. You don't know why the baby is crying. You don't know when the baby is hungry. You don't know why the baby is not burping. And while sleeping, you are afraid that if I keep a hand on the baby, it might choke him. So you're just so scared. And then your partner also is new. He has become the father for the first time. So all these things, plus sometimes you do not get a good family support. The family is not happy with the gender of the baby. Maybe you wanted a male, it's a female, or you wanted a female, it's a male. So sometimes all these things, plus financial problems, your husband is not able to cope up, or you are having lots of pain in your stitches or some kind of infection, either it's a cesarean or a normal delivery, pain will be there, your body ache, plus sleepless nights. So there is so much to cope, so much. Your entire world has changed. Your room is in a mess because everywhere the baby's nappies and the baby's clothes and the baby's howling all the time. You don't know what to do. So all this makes you prone towards depression. But before depression happens, the first thing that comes in, which actually comes in every lady has to go through this after delivery, that is postpartum blues. Why blues? Because it is that blue time, it is that blue negative time which you don't want to come back. And this subsides within 2-3 days or maybe just about a week, because within a week you get accustomed to your baby, the baby gets accustomed to you. Now you know when your baby will sleep, how your baby will sleep, how you will feed him, how you will burp him, and you know how many times he will do potty, how many times he will urinate. Now you're even scared that why he's not doing potty, why his potty is green, why it's black, why it's yellow. So all these things you get accustomed within 5-6 days. So that is called postpartum blues. You just feel like crying a lot, you're very weepy all the time, you have those negative feelings, I won't be able to take care. So all these things happen, and this is very normal. But if this does not get subsided because of whatever risk factor, we will discuss the risk factors later, then you go into the second stage, which is called postpartum depression. Now postpartum depression is something, same symptoms, just exaggerated symptoms and carrying on and on and on, and they are now disturbing your routine life. You are not able to bond with your baby, you do not have a bonding with the family members, you're locking yourself inside the room, you have all those negative feelings coming in. I want to die, I'm not a good mother, I'm worthless, I am ugly, I don't look good. You might even think of harming your baby. You're just thinking all these negative feelings, you're not doing anything. It is just making you feel down and low. You don't feel like eating, you don't feel like sleeping. So all this is basically making you depressed, very depressed, and that is the time when the doctor should step in. You should tell your doctor without any shame that, doctor, I need treatment, because if you take treatment at the right time, you can come out of it very nicely. Now what happens if you do not get treatment, you do not get the family support? Then you enter the third stage, which is postpartum psychosis. Now as the name suggests, psychosis means your brain has stopped working. You are not in the world. You are physically present, but you are mentally not here, right? So you are basically, your brain is not working. So you might start harming yourself. You might even commit suicide. You might even harm your baby. I have seen, when I was long back when I was working in government hospital, I've seen these young girls, 16, 18-year-old, they get married, they deliver. After delivery, they go, my God, they go bizarre, because they are very, very prone to undergo postpartum psychosis. I've even seen cases where they kill their baby. Now why does this happen? We don't know. Whether it was the gender of the baby, which probably the female didn't like, because I've seen that pregnant ladies, especially the lady who has just delivered, they are very, very prone to depression. All those pressure from the mother-in-law, the father-in-law, the sister-in-law, everybody poking. She doesn't say anything. She cries. She cries. I've seen patients crying in the labor room. Oh my God, I wanted a boy, ma'am, I wanted a boy. And they'll keep on weeping. They won't even take the child in their hands. And people don't understand that the hormonal changes that the lady is going through and the pressure that she has, she feels worthless. And that is the time when psychosis sets in, right? So this is a very, very grave mental disorder, and we should not allow, we should not basically let any lady go through that, because it is the first stage and second stage which can be controlled. Okay, now talking about the partner, even the partners, they can undergo depression. That is called paternal postpartum depression. Now why does this happen to them? There's a lot of pressure on the partner as well. Financially, he has to support the family. He has a new member in the family. If the relations between the husband and wife are not good, the husband is not doing well in his service, he's not getting good salary, he doesn't have good relations in the office, or he's become father for the first time, he thinks he's worthless, he thinks he's not able to cope up, because both the parents have to basically wake up at night and take care of the baby. So there are many things. Or if the person is himself mentally weak, he has had history of depression, psychosis. So such, even the fathers, they need good support. This is what I wanted to tell. So it is not just the female. Yes, she is very, very prone, but there is some percentage of problem in the partner, in the male partner as well, because he is also going through a different phase of life. Okay, so now coming to the risk factors, first of all the causes. Now there is no cause as such. We have already discussed it. Why this happens? Because of emotional problems. Something is inevitable because hormonal changes will happen. Body will change. You will lose your normal body structure in the skin and hair. Everything will change. Your life will change. Your social circle will change. Your social life will change. You will not be able to socialize. If you are a social person, yes, everything will change. But there are certain things which can be prevented, like family support, good relations between partners, and financially you should be sound, or you can plan, it has to be planned. So all these causes, all these mixture of environmental factors, they increase your risk towards postpartum depression. These are the risk factors, and the prevention is the same. Just be careful, just be well planned. Do not ignore your symptoms. Go to the doctor. Do not be ashamed that I'm going to a psychiatrist or a psychologist. Please go, because before you do something bad to yourself or to the baby or to the partner, please go and seek treatment, because you are very, very prone to undergo these kind of problems, because it is all the hormones. And of course you need very good family support, so that you get sleep, you get proper food, and your baby also nourishes well. And the baby is sick, if the baby is sick, you have to run to the pediatrician. So there should be people to help you out. How can you do everything on your own? So just be careful, stay healthy, plan your pregnancy, eat healthy, keep reading books, you get a lot of knowledge, keep watching programs, keep watching your YouTube videos like my videos. There are many other videos, so that you are prepared, you are well planned, and nothing goes wrong between you, the baby, and the husband, and of course your family. Okay, so guys, take care. In case you have any more questions, you can always put it in the inbox. I will try and answer them in my live sessions. Okay, so bye bye, take care. I'll be back again with a new video. Take care, bye bye.